Hey there, welcome to the show. Today I have a lovely guest with me, Dr. Prudence Hall. Dr. Prudence Hall started as a traditional gynecological surgeon and transitioned her career to focus on regenerative and integrative medicine. As the founder of the Hall Center in Santa Monica, California, she saw a critical need to address the problems confronting women and men experiencing the stubborn and often debilitating symptoms associated with aging. Her practice is focused exclusively on regenerative medicine, looking into the root causes of conditions and diseases rather than simply treating symptoms. She strives to help clients achieve optimal health and actively prevent disease without the use of pharmaceutical drugs when appropriate. As a health consultant, she strives to help clients achieve optimal well being and actively prevent inevitable decline using proven natural regenerative methods. She's also the author of the book Radiant Again and Forever. Welcome, Dr. Prudence.
Well, thank you so much for having me.
Yeah, what an honor.
Well, I'm honored to be here too.
Good. So we're going to dive into some pretty big questions here. First, I always like to know this when I hear that somebody made a transition from one career to another. What made you transition from a surgeon to regenerative and integrative medicine?
Yes. Well, I started to realize that surgery was a last result tool that we had to help people, and that if we could prevent that system default or breakdown, then that wasn't necessary. So I've always been very natural in terms of how I like to approach the body, even as a gynecologist. But when Jeff Bland, who's the father of functional medicine, started going around the country and teaching really many thousands of people this, doctors and nurses and all kinds of medical people, it made perfect sense to me. The body is not broken down into the brain, the lung, the heart, just like the uterus is not broken down into simply the uterus. I mean, what causes fibroids or ovarian cyst? Well, inflammation plays a very important role in that. So I started identifying what are the core root causes of problems that affect women. And I fell in love with this approach because it's so effective. And I started having much greater and more expansive results. Um, I started doing hormones with bioidentical hormones at the very beginning of my career because I was
Oh,
going back and forth to between France, where I had lived for a number of years, in the United States, and France was a little bit ahead of us. So that has been pretty consistent, but integrating. So it's been a deeper integration and a deeper awareness of knowledge and how the body actually works. So I still do hormones. Now I do hormones pretty much exclusively, but also looking at, well, what causes heart attacks? Well, a lack of estrogen can cause that. And also extreme stress and also diet and and you start putting it together and it's a puzzle. And I find it still extraordinary and fulfilling when I see women just come back to life and ready to assume responsibility and I would say the furthering of their life in the bigger life, having a bigger, more important life for themselves.
yeah, I love that. And I'm with you. I'm a functional health coach and I've been doing it for about a decade. And prior
Ah,
to all this, I would go to conventional doctors and I wasn't getting answers for a lot of my health symptoms. And like many women, they start to, go to Google and they start researching and
yes.
becoming their own doctor. And then they find people like you. And it's almost like a whole new world, but it's also this light bulb moment. Like, oh yeah, there are causes. There are reasons why we feel the way we do. And the epidemic of chronic disease that is happening is so tied into the things that you said, the low hormones, the stress, the lifestyle piece, the diet. And we do have, I believe, so much more control. So,
Do.
yeah, what exactly is regenerative medicine?
Well, to generate means to create, and to regenerate means to recreate. So we're recreating youthful physiology. And I think of the body as, well, we have a chronological age. there's nothing we can do about that. I mean, we go around the sun and we go with it. The earth go we go with the earth. There's a biological age, and that we have enormous impact on. We can go from a biological age of 70 to 50. That's not that difficult to do. We
Wow.
get rid of inflammation, toxicity, stress. I mean, we decrease all these things, balance hormones back to youthful levels. There are all these things that you can do to impact that, change your thoughts, change your action, change your mind. I mean, it's beautiful. And I love to play in that field. I also think there is a psychological age. Some people can be absolutely youthful and kind of dumb psychologically. I mean, I don't mean to be insulting, but it's just like, no, that wasn't compassion on my part. Not dumb, but just very, very young
Mhm.
in perhaps an unschooled or untaught way. And then there's a spiritual age, and that's it. I love to play in the three fields that we can impact with the people that I'm working with. And that's wonderful, by the way. I wanted to just say that's so fabulous that you are a functional medicine coach.
Yeah, thank you.
Yeah, I
Yeah.
just really I've watched that field evolve, and I just love it. I love it.
Yes. Me too. And honestly, I don't I try not to pin things against one another, like conventional versus functional medicine, but they
Yeah.
are quite different. And my hope is that there's a bridge at some point because, yes, there are times where we, of course, need conventional medicine, but addressing, like we said, the root causes and looking at food and lifestyle. This seems like such a duh thing. Like, obviously, we should be looking at that, but we're not as a society. And it seems like there's so much out there for us to learn, so many great resources, but we're almost sicker than ever. What are your thoughts on that in regards to
Oh,
chronic disease and what's going on? And why is there such a lack of help?
we are absolutely sicker than ever. Now, if this is the first generation that's not going to live longer than the last generation. But as individuals, we can live longer. When you look at statistics, that doesn't mean we're talking about you or me. So I think it has to do with the enormous stress that we're facing and that we deal with every day. And this is one of the core root causes of most chronic diseases: heart disease, dementia, cancer, autoimmunity, all the inflammatory diseases. So this is enormous now. We're multitasking. That's not actually good for the brain or good for the body. Secondly, the toxicity is so much increased.
Yeah.
Everything is toxic. We have Roundup in our body, and these glycosates, and it's we're living in a fairly dangerous environment now. And we're delicate. We have this thin membrane that protects us, and everything goes into our lungs, and the food quality has changed tremendously. It's not farm to table for most people. Some people who can afford that are very privileged. I'm very privileged to be able to eat in such an organic, integrated manner. But a lot of people live with packaged foods, ultra
Yes.
processed foods that are heavily sprayed, and have lost their nutrients. So the soil is not as good either, Chloe. It's much more deficient, so our food is more deficient, and so we're going to supplements, which helps to make up for that. But it's not farm to table with good, rich soil.
Yeah.
Um, I think sleep is critical. Yeah, I sleep 8 to 9 hours, but a lot of
Good for
people tell me that they sleep. That's just the way I'm made. I
you.
can
Yeah.
sleep regardless of anything. But some people, well, a lot of my patients, when I initially see them, uh, are sleeping 5 hours and considering themselves lucky.
Wow.
The world is busy and demanding, and it's taking away our lifeblood, kind of, our health. Um, and then, I think the medical profession needs to stand up and take responsibility for what it's doing. We are no longer in one disease, one solution
Mhm.
type of things. Syphilis, okay, you can treat it with easily with one medication. But now we have complex diseases with, really, this is functional medicine. A lot of this is Jeff Bland. Love you, Jeff Bland. But, a lot of it is really that, genetics is 10% of diseases,
Yes.
and yet we can turn on all these genes with our lifestyle and hormones and things that can increase those diseases. Whereas when we're healthy, they just aren't going to be expressed. So genes, we're dealt this card, these cards. Those cards can be turned over and can actually function positively or negatively in our body, or turned over where the body doesn't see them and it's just like they're not there. So we want to turn off the bad genes, turn on the good genes. And doctors don't know about this. They just are not studying enough. Uh, we're following the drug company, kind of input and training. And I'm not against drug companies. I just want rational regulation within that industry.
I'm not anti-pharmaceuticals either. I mean, I've used them myself, and any
Sure.
that comes to us, if they need them, we don't judge, and we say it's not one or the other. If you need medication, but you should also be making all these food and lifestyle changes. You need to be
Yes.
supporting your body
Yes.
even more so, I believe, when you're on a medication. Um, but yeah, it certainly feels like there's just something new every day coming out and a new medication. And you would think with all the information, all the research that we have, there would be more of a priority for changing food and lifestyle, but there just does not seem to be.
I feel a vast immorality too.
Mm, mhm.
We are not, as doctors and educators, and we are not here to bully patients. We're here to look at what their beliefs are and what their goals are and help guide them towards a place of total body wellness in with them as our guide almost. So to put it in a positive way, so the universe really hears this, if you say not, it hears yes. So I love integrity in medicine, honesty, bringing love into solutions. It's really, love and caring for someone is boundless in terms of the results that it can have.
Mhm.
Yeah, where's the compassionate country doctor?
Right.
But
Yeah.
Western medicine is great with tertiary emergency care. We're the best in the world, and
Yes. And of course, that's needed. But like you said, when we started this conversation, like just the amount of chronic disease that is rampant. Uh,
mhm.
and that to me is not really being addressed other than symptom management or medications. So when you speak of regenerative medicine, how does that aim to address root causes of health issues?
Well, let's take dementia.
Mhm.
As just I think 56 million Americans are going to have dementia this year, and I just want to slip in this just about medicine, and then I'll come right back to that question, okay? Uh, the way Western medicine is currently practiced is the fourth leading cause of death in the United States. So that just tells us, well, here's a snapshot. How are we doing? Huh?
Yeah.
How are we the fifth? Are we the fourth? And that's correctly prescribed medication. So anyway, so in terms of how this would look with a specific etiology, now, Alzheimer's disease, Parkinson's, ALS, any kind of neurodegenerative disease is devastating. And one of the ways we look at it is we say, well, what are the core root causes? Diet and sugar is huge. So this is something that we can just eliminate from our diet. Eliminate as much as possible, or choose very healthy choices for this. Pasta, rice, potatoes, bread, cereals, crackers, the kind of quickly broken down carbohydrates that break down into sugar. Exercise is extremely important, and this is documented. In fact, I think I have Dale's book here. I'm sure you know Dale Bredesen, but I just love this prince of a man. He has changed the way functional the way we look at Alzheimer's. In fact, when he came out of research, we connected, and I'd been involved in with functional medicine for a long time, and he was saying, "Well, how do I put this together?" And we would have he's just wonderful, fascinating talks about that. So then you look at exercise, that's proven. You look at hormones. Dale would tell me, Dr. Bredesen would tell me, Prudence, keep giving those women estrogen. It's so important for their brain. And I know that it's not only estrogen, it's also testosterone. It's also thyroid. Thyroid gland is right here in the neck and runs our metabolism and is a natural antidepressant and causes us to lose weight or obtain our ideal body weight. So you look at these things. So you change your diet, you sleep 8 to 9 hours, balance all your hormones back to youthful levels, start exercising and, healthy, smart exercise. And then there are all these integrated methods that also work well, homeopathy is actually quite good with. Now, this is not research based, so this is something that's my own experience with patients, and over the last 4 decades, that it helps, and acupuncture helps, perhaps by decreasing stress, or perhaps by we're energetic beings. We're made out of electrons and protons. The mitochondria, the beautiful powerhouse of each cell, has to maintain itself. So, in all diseases, you want to maintain mitochondrial function. Um, Toxicity, that's a bad one for Alzheimer's disease. It's very tough to kind of identify that. I mean, we're there people who specialize in Alzheimer's disease, all of Dr. Bredesen's team and doctors he's trained absolutely do it. And there are panels that you can look at. Doctor's Data is one of them. That's a urine test. And there are other very sophisticated tests to look at how much, Roundup we have in our body, or, these other things. So detoxify, sleep, eat well, balance your hormones all back to youthful levels, and you have a really good chance. And then there's like hyperbaric chambers and all this kind of stuff where you can do this stuff with the brain where it's positive, negative in terms of oxygen and things. And it's preventable and it's curable.
Yeah, I agree. And I'm sure a lot of my audience, they're listening to this and they're like, oh, where have we heard that from? Like I'm constantly
Stop
saying,
it.
right, beating that drum, like get your sleep, move your body, eat good food, balance your hormones or
Oh,
optimize your hormones. I know balancing is kind of a not really something that's super easy. Your hormones are never balanced, right? They're supposed to flow and move, but
yes, yes.
hormone replacement therapy, bioidentical hormone replacement therapy
Mhm.
could really optimize them. So I'm a big fan. I
Optimize it.
utilize it myself. So can you speak a little bit more to how you use hormone therapy with clients? What made you even get into it? Because years ago, I'm sure, I mean, you could even speak about the Women's Health Initiative, how for years it's been
Mhm,
demonized.
mhm. So I graduated from my OBGYN residency in 1982. And at that point, I had been taught in the menopause clinic. I trained at USC in the big county hospital. I think it's one of the I'm so grateful for the education I received in terms of everything I learned. OBGYN is a surgical subspecialty. We know how to repair through surgery, and that was a lot of training, obstetrics, learning how to deliver and all the emergencies in surgery. But we did have a menopause clinic, and what we did was we saw probably 50 patients a day, each of us, and we would ask when the last period was. If it's more than a year, we can assume, which is not actually true, that they're in menopause. And secondly, we would get one value, one lab value is the FSH, the follicle stimulating hormone. And that's the pituitary hormone that rises when the brain is trying to get more estrogen. So the brain takes care of herself. I mean, it's like, give me this. I'm hungry. I'm thirsty. I'm sleepy. Give me some estrogen. So that level rises. And when it's above 20, I was taught that that's menopause. You give them Premarin at the time and see them back in a year. And Provera, that's a synthetic progesterone. Prim is pregnant mare horse, a pregnant horse. In is urine. And in the mid 40s, I think probably pretty sincere people were trying to find a way to help women.
Yeah.
And they came up with all kinds of different solutions, but the pregnant mare's urine, where they'd put a little tube catheter into the bladder of these poor horses that would be, in small stalls and immobile. It was taken out, spun down, and it was pretty much just pregnant mare's urine. And they found some real benefits from it. Now, when I went into practice in Santa Monica in California, I did that. I, you know, I thought I was really hot shit, man. I mean, I had saved lives. I knew how to, handle botched abortions and very complex surgical cases, and I felt competent. And then my menopause patients started coming, and they'd say, "Prudence, what do you mean see you in a year?" It called me up. It was like, "I'm dying. I'm gonna off myself." I mean, really, I was not aware of
Yeah.
the terrible misery that comes that can arise and that frequently arises from menopause. Sleepless, exhaustion, can't think, can't, overeating, gaining 50 pounds, losing their marriages, losing the love of their children because they're screaming nonstop. And so it's just like, oh my God, I shouldn't be in this field.
Yeah.
I,
Well,
I really am not well trained, and I'm not helping. I'm actually hurting people. So I just started learning. And Europe did have more data at the time than we did. So I would go there and bring back these hormones, and women started to get better. And it's just been nonstop learning. And that's why that functional medicine piece, regenerative medicine piece was so important for me, because I needed to know how the body worked. It's not just that the uterus bleeds or a fibroid occurs. Oh, it must be
yeah.
genetic, although there is a genetic component. And so preventing the diseases. So I had not used Premarin in 2001 when the Women's Health Initiative came out, for years, really since probably 1983.
Oh, wow. Okay.
Yeah. So, I looked at it and said, of course, it's not effective. It does get
Mhm.
rid of hot flushes, but not as well as, the bioidentical natural hormones. But it doesn't impact any of the diseases. So I use hormones and optimize hormones, not just to get rid of symptoms, which my board says that's the only thing I can say. I can say it gets rid of osteoporosis and gets rid of symptoms. It's like bullshit. It helps to prevent dementia and cancers and autoimmunity and heart disease. Heart disease is the number one cause of death in women,
Yes.
and it catches up to men at menopause. And it is not the only thing that hormones do. And look, it's now we're out of those ages when I was kind of suffering a fair amount, being this voice saying this and saying this. Now it's caught up, Claudia. I think that
It
thanks,
is. It's
right?
catching
It
up.
tipped.
I feel in the last few years, it's almost blown up. I obviously, this is a we talk a lot about perimenopause on this podcast,
Oh,
but
yeah.
obviously perimenopause, at some point, you're gonna go through menopause. So my goal is to educate women, and I feel that in the last few years, even just the perimenopause topic has been very big, which I'm loving. I think it's so important because we do need to prepare women. But there is still so much resistance in conventional medicine when it comes to
Yes.
hormone replacement therapy. Can you speak to that a little bit? And
Yeah.
yeah, like
Yeah.
are you doing anything in regards to educating even other practitioners?
Well, I've educated a lot of doctors. Doctors will sit with me in the practice. They used to do that a lot. Naturopathic doctors, I taught very briefly. A good group of naturopathic doctors. I've taught many doctors in Israel also because I opened a little clinic there, and I spoke there a few times, and I really fell in love with Israel. I didn't know Israel. I'm not actually Jewish. Don't tell Israel that. But I really fell in love with the culture and saw that the women there are so strong and deny themselves a
Mhm.
lot of, sweetness, and that menopause impacted them even more than in the United States. So, I was working there and taught doctors there, and I think it's doing much better in these countries. Well, look at how far behind I was. There wasn't even a field of hormonal management when I came out. There's infertility, and that
Mhm.
was helpful. I mean, the Dr. Mars at USC delivered the second test tube baby. We were calling them test tube babies at the time, and so that field is really advanced, and it's taken really, this is 40 years, a couple of, that I've been hacking away at this. And I think that it just, the data has accumulated. People are
Yeah.
waking up, but still, doctors in a traditional practice, gynecologists, are involved with so many different things, pap smears and deliveries and surgeries. And it's what I've been really wanting to see happen is that within gynecology, there's a specialty of women's hormones, and that would be thyroid, adrenals, D3, optimizing our hemoglobin A1C, which is the 4-month marker for sugar damage in our body, very critical, important. And, of course, all the reproductive hormones and our pituitary hypothalamic hormones. Right now, they go to a lot of gynecological endocrinologists, or they go to an endocrinologist who are not trained in handling menopause.
They're
And
not.
yeah, and they in the United States, they don't really do thyroid, I think, in the correct way.
Nope.
Europeans are years ahead in terms
Wow.
of managing thyroid.
Yeah,
And,
even testing, getting an appropriate thyroid panel is so difficult for a lot of clients. So we're able to order some panels and we give them a list and oftentimes they'll just go to
yeah,
their doctor and their doctor will only do a couple of them or they'll say, "Oh, your insurance doesn't cover it," or if it's out of range, we'll order that. And I'm just like, "Ah."
yeah,
I
yeah,
don't
that's really
understand.
heartbreaking. Yeah,
Yeah.
because that thyroid 3, so the gland is right here, it makes T4, thyroid 4, levothyroxine, it breaks down in the cells or in the body as it circulates through the body into T3, which is liothyronine. And liothyronine is 6 times more potent than T4. So endocrinologists frequently do not even look at the free T4 or the reverse T3 or the antibodies. Antibodies mean that the body is rejecting the thyroid. So that would be Hashimoto's. And viruses play a big role in that. And also diet, gluten seems to exacerbate many autoimmune diseases. So I have empathy for doctors in my field. And also, there is a calling. We went into this field to be excellent and to achieve integrity and to really be in service. And we have to keep up and to learn. I think a lot of gynecologists felt so bad that they had been prescribing Premarin, and Provera is a carcinogen, medroxyprogesterone. The 20-year study that came out about Premarin, and that came out in 2001, actually showed that there were significant decreases in breast cancer with Premarin, women taking Premarin alone as opposed to no hormones. But
Mhm.
Premarin is not a natural hormone,
Right.
so it's also inflammatory. So it doesn't decrease, the chronic diseases, heart disease. When I prescribe estrogen, estradiol, I see the LDLs just drop like this. It's just like, wow, this is beautiful. And the
Yeah.
subparticles, total cholesterol, HDL, generally good. LDL can be bad. And then I look at the subparticles, the ApoB, the LP little a, then in homocysteine, and look at the inflammatory markers, high sensitivity, CRP, and they just drop through the floor. And if they don't, niacin can help. That's a B vitamin. So I'm
Mhm.
not really feel that friendly towards Lipitor. I mean,
Right.
Dr. Bredesen said, there's one medication that's Alzheimergenic. I don't want to
Mhm.
quote him. I mean, he might be changing his opinion some, but
Okay.
I was trained in that. I'm sticking with that. It's
Yeah.
Lipitor can be statins can be Alzheimergenic.
Yeah. Yeah. And most people aren't aware of that when they're told to go on them, which is horrifying. I feel like there is a lack of informed consent and
That
just
is true.
education in general.
That is true.
And I feel for doctors too. I guess sometimes I can get on my soapbox because I have been so frustrated by so many of them. And we see it with clients and they get dismissed. And listen, there's some doctors that, quite frankly, they probably shouldn't be in that field. But there are doctors like you and others that we've had here and that I have worked with who want to learn and they're always evolving and showing empathy and compassion and being humble and admitting
Um,
that they don't know what they don't know. I think that's so important with any practitioner.
yeah. How can we be arrogant? Western medicine has been around 100 years. I mean, when was penicillin invented? The 1920s. So here we are 100 years later. We're not like acupuncture, 2,000-year-old, based in 2,000 years of knowledge. So arrogance is something that doctors have been trained to be.
Wow.
And I think it's overcoming our frailty and our uncertainty and our maybe fear. I went to UC Berkeley, UC San Francisco medical school that took 12 students each year, and they were experimenting with different ways to train doctors. And the training was incredibly good. And
Wow.
I mean, I never felt like I was ever better or more gifted or more than anyone on that team, including psychologists and educators and, the whole team put together. Um, so we need to have some different ways of training doctors, not to be taught by the pharmaceutical industry, but to be curious in how to collect data and how to stay abreast in the field, in whatever their chosen field is.
Well, you're leading the way. And my hope, even with this podcast, is to continue to spread the word and bring wonderful experts like you on to teach others and to hopefully open other practitioners' eyes a bit more and um, even give them almost the permission to ask questions and be okay with admitting that maybe you worked in a way that wasn't benefiting others. It's okay. It's okay.
Yeah,
Everybody makes mistakes and
sure.
you that's how you learn.
That's how you learn.
Yeah.
And that's when humility comes in.
Mhm.
Like when I think about all the thousands of times I prescribed the birth control pill up until the time that I started doing testing like I do with women. I do hundreds and hundreds and hundreds of thousands, probably millions of lab values since I started. And when women came into me who were 18 and 20 and said, I can't sleep and I've gained 15 pounds. I'm on Adderall because my brain's not working. I just realized I have ADHD and it's being treated and I'm depressed. I'm on Zoloft and what's going on? And I realized that the birth control pill suppresses the connection between the pituitary and the ovary, and women's hormones looked like they were menopausal when I
Yeah.
started measuring them. And I had to, be compassionate to myself that I had prescribed without knowledge, without this kind of knowledge. And I think most gynecologists have no idea this is true. My residency at USC was supported by birth control pill companies. And I'm
Yeah.
very grateful for that education. And I'm sure that the birth control pill is appropriate for some women,
Mhm.
but it is devastating to our hormones. And as
Yes.
I'm measuring these hormones, seeing if women are getting their hormones back, sometimes it's a year or two, sometimes
Mhm.
it's never. So,
Right. Especially if they're over a certain age bracket. I mean, a lot of women will be on hormonal birth control for 15, 20 or so years. And then in their 40s, they start to experience perimenopausal symptoms. And oftentimes they don't want to come off of it, or doctors will tell them to go on it at that
yeah.
point. What are your thoughts on that?
Well, I'm always saying, please don't take the pill.
Yeah.
Please do not take the pill. So I take women off the pill with their permission and
Mhm.
after education and looking at their hormones. So just like with my menopausal patients, we're looking at their hormones of a 22-year-old and they go like this, oh, this is terrible. Oh, no wonder why I don't have a sex drive. My testosterone level is 7. And it's like, yes. And would you like to, optimize those hormones?
Mhm.
And they generally say, yes. Well, what can I use for birth control? And then that's a whole nother discussion. But, they come off the birth control pill and then I measure them at 3 months and I measure them at 6 months. And I always have a backup because if you take someone off the birth control pill and don't give them any kind of hormonal management, the possibility for that, they could really go off the deep end. So it's like,
Yes.
okay, if this happens and we call them in 3 weeks, how you doing? Are you feeling more depressed? Are you feeling more tired? And, I can temporarily give them either cream, use these
Mhm.
creams, or the patch, which is pharmaceutical, the
Yeah.
0.025 patch, to help them kind of not so much hormones. So it would suppress their own production of hormones, but just enough so they're not going to really be cast into misery. Now, I would say maybe 30% of people on the birth control pill need that. Other times women will come back and just, they start to make their own hormones and they tell me they can't even believe that they feel this way. But
Yes.
you mentioned that perimenopause is in the 40s. I would say, and you probably agree that perimenopause starts in our mid to later 30s. I see
Yes.
that all the time.
I did. My symptoms were very loud. I have a history of a prolactinoma, so my situation's a little more complex. But I had, 13 years I was on birth control. Was switching to one from one to another because I had all these symptoms, and I would just go to my doctor, and she would just be like, "Here's a new one to try. Here's a new one to try," and I trusted her. I don't fault her necessarily. A lot of what you were saying, she didn't know what she didn't know. But then I got to a point where I think when I was around 30. and I just felt horrible. And I said, "That's it. Something is wrong." And I started to dig deeper. I went to another doctor, and that's when they found the prolactinoma. But in my late 30s, I started to like I was starting to feel really good because I'm a health coach and I started implementing all the dietary changes and I was like, "Oh, I'm thriving even with the prolactinoma." But in my late 30s, I just hit a wall. Oh my goodness. I mean, my sleep was off, anxiety, overwhelm. I was having a hard time losing weight. My mood was in the toilet, like just depressed. And, I'm running a business. I'm like, well, I can't do what I want to do when I'm feeling lousy. So yeah, then I realized like, wow, I'm starting perimenopause and I never had children. So there's just like a few different things working against me, right? And I started bioidentical hormone replacement therapy at 40
Yeah.
and
Excellent. That is
made
good care.
a
I wish you could have started at 35, but that is
yeah,
very, very
too.
good care.
I
And
think of that.
doctors don't recognize this. Gynecologists really are not recognizing perimenopause.
They're not.
And subtle changes in the follicle stimulating hormone is very important, like an FSH of 6 on day 2, of the cycle. When I mean, that's a very good time, just like for fertility, to look at our hormones, or maybe day 21, where we can also look at the progesterone. So the cycle is when our period begins, no progesterone, no progesterone. We ovulate, estradiol levels go up to 3 to 500, and then progesterone comes in, and progesterone surges in and then comes out. That's the menstrual cycle. So, after we've had estrogen for 21 days in the cycle, estrogen can look, I would say most gynecologists would say, "Oh, your estrogen level is 90. That's fine." And it's like, no, all those symptoms you had are symptoms of menopause and perimenopause: hot flashes, brain fog, night sweats, depression, anxiety, weight gain, sleeplessness, night sweats. Women will tell me all the time, I'm developing night sweats. When is it? Around the period. That's when our estradiol levels are lowest in the cycle.
Yes.
4 or 5 days before, and 2, 3 days into the cycle, estrogen is quite low. So on day 2, our estradiol level should be 75, 80. It starts at 60 and then soars. So an estradiol level of, I don't know if this is too technical or not, but 100, for example, on day 21, you're missing 100. You're missing 85 or 75 picograms of estradiol. And so I look at where they are in the cycle, and then what symptoms they have, and then what their lab values are doing. Well, let's say their testosterone is 20. We can't trust as ideal the lab values that the laboratory, like Quest, LabCorp, all of these companies use, because all they do is they measure whoever comes into the lab. So they're looking at many unhealthy people and their hormone levels and saying that that is the normal. So, as functional medicine doctors, we look at optimal levels, youthful levels, levels that not only get rid of symptoms that we have, but also help to decrease the diseases that arise from low or unhealthy or unyouthful hormones. So, yeah, perimenopause. Boy, women will tell me all the time, I've seen 3 doctors. Everybody
Oh,
says I'm fine, and I'm saying, "Well, your adrenals are low, your thyroid is actually, your T3 is actually 2.6, it should be 3.1 to 3.2." And Terry Hertog out of Belgium is the best in the world for this. He is phenomenal as an endocrinologist. I've learned so much from him. And, that T3 is very important. And if his research shows that if you do not have a T3 of at least 3.1, at least, then that thyroid is low.
yeah.
There's a T4 to T3 conversion problem, or the T4 levothyroxine made from the thyroid is not converting into T3, or there is simply everything is low in terms of your thyroid production. Thyroid's very delicate.
Oh, yeah.
And I would say that postpartum, that's the time that a lot of women develop um, hypothyroidism, low
Yes.
thyroid, because the baby takes all of our iodine. So if you want to help your thyroid right now, 3 Brazil nuts, which has selenium, you need 200 micrograms of selenium, and iodine. Crow's Lugol's is a good combination, or iodoral, good one. So there's a lot of, ways to help prevent decline naturally.
Yes. I agree. Oh, I could talk to you for hours. We're on the same page with all of it.
Mm. I'm so
So
glad
I
you're here to help to help doctors.
I do my best, right? And that's why I like to bring doctors on because obviously I can't prescribe. I could do all the food and lifestyle coaching and we utilize supplements with clients and we're always encouraging them to get comprehensive blood work and really advocate for themselves because like we said earlier, a lot of doctors aren't doing they're not even ordering the right labs. So how could anybody get the help they need if they don't have any data in front of them? Um, but what I also love that you said, and I hope some of my audience picked up on this, was that you can't just look at lab values. Because I've said this before, a lot of people, yes, you want to test your hormones, you want to test all the things, but look at the woman in front of you. What's your age? What are your symptoms? That's going to really tell you all that you need to know in addition to the lab values, because it seems like a lot of practitioners will look at lab values alone to determine whether or not a woman needs hormone replacement therapy, for example.
And they'll miss it because they'll just say, "Oh, the estrogen looks more or less fine," but it's on day 21 of the cycle rather than day 2, and it might look really good. Yeah, and they really are not aware of the FSH. I would say most doctors do not follow the FSH in terms of but it's like the TSH, thyroid stimulating hormone stimulates the thyroid. So when the TSH is high, that means the thyroid is low. So the brain is saying, "Give me more, give me more, give me more," and up it comes, up it comes if the gland is healthy enough. So the follicle stimulating hormone uh, talks to the ovary and says, "I need more estrogen." Estrogen is critical for the female brain. And also, Abe Morgentaler, who's the father of testosterone therapy out of Harvard, and I just love this guy too. These are three like top people I've mentioned in this field. Uh, they're finding now that estradiol for men actually is important. And we used to be concerned about that. And we used to try to lower the estradiol. And, or some people are trying to give more estradiol to men. But now we know, when men have healthy testosterone levels, they generally will break down. Testosterone breaks down into dihydrotestosterone, which is a metabolite, or estradiol, like that. And that the estradiol is actually healthy for the men's brain and healthier for their heart. So it's just so cool.
It is so cool. I love every time I speak to somebody else, I hear something new and I'm like, oh my gosh, it's amazing. And it kind of just it drives me nuts that hormones have been so demonized. And I think to myself,
Mm.
they are needed for nearly every function, if not every function in the body. Why are we demonizing them? So I'm over here like team estrogen.
This is Avram Blooming, and he's now retired. But he wrote, I would say, an incredibly important book about estrogen and breast cancer, looking at the studies and uh, look, estrogen, breast cancer does not prevent women from using estrogen. And I don't just say, "Oh, you've had breast cancer, so let's give you estrogen." I send women to an oncologist who's awakened in terms of the knowledge and skilled with the knowledge. Let them tell me if it's all right. And I would say that, 98% of the time they say yes. And people say, "Oh, I have an estrogen positive breast cancer." It's like, well, if you biopsy my breast or your breast, that normal breast tissue will absolutely have estrogen and progesterone receptors, just like the brain will and the bones will. And a receptor means that hormones can go in to the cell. It's sort of like a dock. The ship comes in, docks, and that's what happens with the cell. How do things go inside the cell? Well, if the receptor's on the cell, it can go right in, and then it creates function. So I call hormones our body's software. Because if you
Mhm.
go to the computer, you want to boot up, there's no software, they're waving lines, you're not going to get good data. The same thing happens to our cells. So, with our breast cancers, it's a good thing that they have estrogen positive and uh, progesterone receptors, positive estrogen and progesterone. That means the tissue looks more normal. And, right now, the therapy is to decrease any amount of estrogen that woman has. And this field is evolving, though. It is evolving. And we realize that there's a huge jump in breast cancer right at menopause, and that's because we lose our body software and the cells don't know what to do. And so there's more inflammation and all of the core root causes of diseases, especially cancer. And then again, when you're not on hormones, around 74, 75. And going back to how sick we are, the number of women developing breast cancer now is in a lifetime, over a full lifetime, 1 out of 7, some people say 1 out of 10, but it's someplace in that area. And it is preventable. And hormones help to prevent most of the cancers by decreasing inflammation, stress, blood sugar, and some of the unhealthy bioparameters of aging.
So I want to talk a little bit about your book, Radiant Again and Forever. I have not read it yet, so I will add that to my list. So can you talk a little bit about that? What does it mean to you to age with radiance?
It means to reclaim the parts of yourself that you have lost in this aging process. And in addition to reclaiming your energy and focus of the brain and better muscle mass, and we have wisdom with aging. And all the stuff that we have learned in menopause, it tends to become less important. I mean, we're in survival mode in menopause. It's a death process. So we're in survival mode. But once that starts to correct itself, through all the things we said, lifestyle, decreasing toxicity, decreasing all that, women come back and they have these shimmering eyes that are alive and they say, I'm starting an orphanage. It's like, really? You're starting an orphanage? Yeah, I'm climbing these mountains. My body is so strong. I'm now I'm now inspiring other women to take care of their health. And I became a functional medicine coach.
Yeah.
you know. And so as women, we are the light. We are light in the world, compassion and empathy and love and caring. And we take care of our children. We take care of our families. We take care of our communities. So they become more of who they really are. And they're no longer exhausted and defeated. And they can continue pursuing that who am I? That self knowledge. Change yourself, change everyone you come in contact with.
A lot of people may think like, oh, that's so far fetched. Hormones alone can't do that. And I'm like, but yes, they can. Life-giving. I feel the same. I mean, I almost closed my business a few years ago. I was like, I can't continue to do this. I felt so horrible. But I said, nope, I have work to do in this world. I want to continue doing this. And I was, even though there's, resistance again in conventional medicine and just women in perimenopause, and it's like, oh, it's not a thing. I was like, nope. I believe I know I'm not imagining these symptoms. I know I have work to do in this world. So I got on those hormones and I'm telling you, it was life changing. It was almost, and I struggled with depression for years, even prior to that, but it really got worse in my late 30s. And it was almost as if this cloud lifted. I get emotional even talking about it because so many women, especially in their perimenopausal to menopausal years, struggle with depression. And to me, I'm like, there are solutions to this.
That's beautiful that you personally experienced what that was like and the difference that was your springboard. So I'm always saying, Joseph Campbell, follow your bliss. Who are you? What do you love doing? And sometimes it's just like, I want to know who I am. That path of self realization and self awareness is an enormously beneficial path for people to follow or to be on. It's curiosity. And when we change ourselves, look, you changed yourself. You're changing thousands and thousands of people, millions maybe of people. And this is a life well lived, not only for ourselves, but for other people. It's not only a life well lived for ourselves, but it's a life in service to others, which you want to be happy, be in service. You want to feel joy, be in the service. It doesn't matter what it is, be in service, give to others. And that person who is joyful just by their own energy is in service to the world. So we don't necessarily have to start orphanages or write books or become doctors or whatever we decide to do, but we can just be, and we can be our own radiance.
Well, thank you. That was lovely. I'm so happy that you're here today. So where can women find you?
Well, they can go to thehallcenter.com and they can make an appointment there. I mainly work on Zoom and on videos, but also on phone calls. My daughter is in the center now. Her name is Dr. Beryl Britton. She's a fabulous naturopathic physician, and she's one of the many doctors that I've trained. She's great. So if they want to be seen in person, she can see them.
I'm going to leave all of your links to your book, your social media, as well as your website in the show notes. And thank you again for being here. We will see you all next week. Hey, before you go, if you're resonating with this podcast and realize that your symptoms are anything but normal, my comprehensive program, The Hormone Rescue, may be a great fit for you. My team and I help women in their mid-30s to early 50s improve symptoms such as fatigue, disrupted sleep, anxiety, erratic moods, bloating, and so much more. We do this by utilizing functional testing, comprehensive blood work review, a personalized plan tailored to you, women's health and hormones education, and ongoing support. If you're ready to commit to your health and feel better than you have in years, check out the link in the show notes to learn more about the Hormone Rescue. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.